we're going to start this morning by talking about what's being done to protect care homes and those in need of care from in their own home from coronavirus.
MP Peter Kyle is leading the charge to do just that. He's calling for all caregivers and indeed all staff who step foot in a care home to be tested for the virus. We're going to be speaking to him in just a moment.
Yeah, but first we can talk to broadcaster Shelagh Fogarty, who's taken her own steps to protect her elderly mother from COVID-19. She joins us now. Good morning to you, Shelagh. Lovely to see you.
Hello.
So
you too. Hi.
You've really taken things into your own hand here. You've made a big decision that's going to have an impact on your life. Just explain where you are and what you're doing.
Well, I'm sitting in my childhood bedroom is where I am with my Donny Osmond posters on the wall, but they were only printed out as a joke a week ago by a friend. Yeah, it wasn't just my decision. It was a decision of me and my 6 siblings. So we're fortunate. We're a big family. We can all pull our weight in different ways. Just a few weeks ago, really, as soon as I came back up here, I've been here for 2 weeks now, and I'm fortunate I'm able to continue to work. But as soon as I came up here, I just thought, well, if my company is allowing me to work from home, it's clearly serious. You know, I mean, I knew because I'm talking about it every day that it's serious. And I just looked at the situation we were in and I thought, well, my siblings and I are coming and going in the house, too many of us probably. My brothers and sisters-in-law are doing the same, a couple of carers coming a few hours a week, all with the absolute best of intentions. And I just thought there's too much human biology in this house, given what we're facing. So we made the decision to stop using the carers, and we're still in contact with them, and we're going to make sure that they are okay financially as well. But to stop using them for now, because I'm basically living here with my mum until this madness is over. So that covers a lot of bases in one go. So far, I am well, so that's good. And just one other sibling is coming into the house and sharing those care duties. The rest of us are coming and going, but staying outside and delivering food to us and waving through the window and, you know, waving from the gate and that kind of thing. But we just felt we had to really, that the only way really that we could reduce the risk to my mother, who has a number of conditions that she has to live with and tolerate and bear, was to just remove DNA from the house as much as possible. It might sound a bit crazy, but it just felt like the right thing to do at the time. I just thought, right, we need to control this situation. And it is about controlling environments, really.
And so, I mean, as you say, it's got nothing to do with the carers, the cleanliness.
Not at all, no.
They were
Not at all.
incredibly careful, wiped everything down, put gloves on when they came in. But it is just for you, just limiting contact with outside people.
It is, and when I spoke to the carers about it, I said this is not about your care, which is brilliant, and the measures you're taking and the measures your company has taken are absolutely top, you know. But those carers are doing 2 things every day. They're going to their own home, over which naturally I have no control, and why would I? But they're going to other people's homes as well, coming and going to other people's homes to care for them. So before they came to my mum to do a few bits, they'd help somebody else get out of bed, get showered, and, you know, and some people absolutely need those carers to continue to do that. But we looked at our situation and said, actually, we can reconfigure here so that we, for now, do not need anything like that. So that's what we decided to do. But absolutely, it's not a reflection of the carers, because they were brilliant and the company's been communicating previously with us absolutely brilliantly as well.
So I guess, Shelagh, this is sort of a situation that might be the same in care homes up and down the country, that, you know, sons and daughters are not being allowed to go and see their parents, and yet agency staff are still coming in. So they are being exposed from the outside. Do you worry about that?
Yeah, I mean, this is the big anomaly, really, because I spoke about this on my LBC programme yesterday, and my goodness, I had some absolutely heartbreaking calls. One woman in particular has stayed with me, Sophie, who is a former nurse. She has a 30-year-old daughter with multiple disabilities who lives in residential care. It's a kind of bungalow setting with a lovely garden and everything, with a number of other adult women with severe disabilities as well. And normally she would come and go and see her daughter, and she has, you know, it's very specialist care in that home. Understandably, because of what the situation we're in, the home has had to say to the relatives, you can no longer come and see your children, your adult children. And as the weeks have gone on and Sophie's living with this, she's missing her daughter. She just said, I'm missing her so much when she spoke to me. And of course she is. And she's vulnerable anyway. And she is keeping to her end of the bargain. And again, this isn't a criticism of carers, of agency carers. Of course it's not. It's almost it's not even a criticism. It's just, I'm questioning what the word essential means. Clearly, we need to reduce DNA, as I describe it, in every household, including care settings. But that 30-year-old daughter of Sophie's, Rachel, she doesn't understand why her mum is no longer visiting her. She doesn't understand why the carers can still be with her, but her mum can't be with her. And agency carers come and go from different homes. So they bring risk into the house. But your own relative, one relative, I'm not suggesting that 20 people go and visit somebody, but that this very vulnerable woman's mother cannot see her. And if because of the risk of those agency nurses going back and forth, agency carers going back and forth, if, God forbid, Rachel were to get COVID, that's it. Her mother would never see her.
The thing is that also, thank you, Sheila. Thank you very much indeed for that.
Thank you.
Testing would be one of those things that would alleviate the risks involved. And Peter, who is Peter Kyle, he's the Labour MP for Hove and Port Slade, has been calling for more testing. Morning, Peter.
Good morning.
Morning.
And so what is it that you're asking the government? Because I know you've been quite outspoken in Prime Minister's questions.
That's right. I mean, you just heard a fantastic example of what people are doing to protect their relatives at home. We need to bring the same kind of approach into care homes, because the system we have for social care, keeping people safe in homes, the system keeps people safe. But what we have now with COVID-19 is that because we have so many agency workers who are working in multiple homes in the same day and definitely in the same week, then the system itself is responsible for the contagion. So we've got to sort the system out. So there is a simple premise here that if you have a care home with people living into extreme old age, if COVID-19 makes its way into the home, unfortunately, it will kill people. Therefore, the only strategy that is going to be effective to keep people safe is to keep COVID-19 out of the home. And that means the only way to do that is to make sure that people who go into the home are tested negative. It's the only way we can keep people safe.
You had a constituent, a 94-year-old man who sadly lost his life. What happened there?
Well, Giuseppe he exhibited the symptoms of coronavirus. The care staff did exactly what they were supposed to do. They called the authorities straight away, but it took 10 days for the test to arrive. When the test arrived, by that time, 14 other residents were exhibiting symptoms. 7 staff were off sick. 1 ended up in intensive care. All 7 of those staff were agency staff who'd worked in other care homes. Now, there are other care homes locally here that now have COVID-19 in the care home, tested positive. So what we need to do is 2 things. Get all of the protective equipment that people need into the home so that when people express the symptoms and it's been confirmed that it's in the home, all the care workers have all of the equipment they need. Secondly, and most importantly, we've got to start testing people who work in care homes. The carers, the managers, the chefs and cooks, and the cleaners, they all need to be tested. Because unfortunately, right now, our care home system is preparing itself for the worst. But worse than that, though, Philip, the system itself, the government strategy, is driving us towards the worst because they're not testing the people who are moving between the homes.
And you've actually gone on further. You're saying this lack of testing and lack of equipment is becoming a national scandal, and that we are going to see loss of life across the care network, unnecessary loss of life.
Oh, but Holly, we've already seen it. You know, Giuseppe shouldn't have died. Families aren't allowed into care homes anymore. I'm self-isolating. I'm doing all of the stuff that the government tells me to do. I'm staying at home. But what's the point if all the care home staff themselves are moving between homes? The whole idea is we need to sort of lock this down and make sure we have a stable environment. The care staff and care workers, they are angels and heroes. They're incredible. I've spoken to so many and heard so many. I know of ones who are sleeping in camper vans outside the home because they don't want to contaminate the home. I know others who are sleeping on the floor in care homes because they just don't want to leave and put people at risk. But there are other situations where it's simply not possible. So we need to get a real grip on this now. Giuseppe lost his life. He was 94, so, you know, let's be honest, he didn't have that much longer left. But the point is, his family, and I spoke to his daughter the day after he died, his daughter said to me that their family, somebody from his family had held his hand for every day for 7 years. But right there at the moment he needed them the most, they weren't there to hold his hand as he died. So the sadness, the the sort of wrenching sadness that goes along with what is happening at the moment is going to scar our country for forever if we don't get a grip on this. It's a terrible thing that's unfolding, and also it is avoidable. If we could get our act together, get the testing done, make sure people are tested before they go into an environment that is jam-packed with really vulnerable people, then we are unfortunately having a strategy that is responsible for the loss of life. It's not just, it's not just sort of a bystander. It is responsible for it, and that's what government has got to accept.
Well, we're going to be talking more about testing with Zoe in just a moment. Thank you very much indeed, Peter.
Thank you.
Also, thanks to Shelagh.